Take care of yourself. Your mind is very important apart from just the body, right? Hello and welcome to Boss's Money.
Hi, my name is Danielle Green. I work with Resolve Crisis Services. I'm a clinician who works with people in the community with whatever they are struggling with in terms of their mental health. So I work at the Resolve Crisis Center. It's 24/7, 7 days a week, and we service all of people in Allegheny County. So whatever you deem a crisis, we will assist you with. If you need to talk, we will talk. If you need to see us, we will be there to see you. So feel free to reach out to us 24/7, 7 days a week at Resolve Crisis Services at 1-888-796-8226, 24/7, 7 days a week.
That's very exciting, Daniel. So does it mean anyone struggling or they feel like in a crisis they can call Resolve?
Yes, and you don't have to necessarily be in crisis. You can just say, hey, I just need to talk. I'm having a bad day today and I don't have anyone to talk to, and I need to talk. And so you can pick up the phone and just talk to us on the phone about whatever you feel like you need support with.
Do you have like an age limit who can call in, or it's open for anyone?
Anyone from the age of 5 all the way up until 85 to
Really?
105. So there's no age limits. Anyone can pick up the phone. Kids can call and talk about school issues. They can talk about home issues. And parents can also call to talk about issues with their children. And so it doesn't matter the age. It doesn't matter the issue. You can always pick up the phone and get that support. In addition to us coming out to you to provide that support face to face in the comfort of your home.
It's very important for us to take care of our lives and our mental state as well, and it's exciting to have this information. How much does it cost to see you?
It costs absolutely nothing. We are a free service, and all you have to do is say I need, and we'll be there, and it doesn't cost you anything. You can call us one time in your lifetime, or you can call us every day, and if you need us to come out every day, we will be there every day to support you free of charge.
Thank you so much,
No problem.
Danielle, for this information. Really, our community needs to know this, because it wasn't until now that I got to know about Resolve. Thank you so much for sharing. Is there any last word?
Please, people, if you need help, don't suffer in silence. Our services are out here for anyone to utilize. You don't even have to tell us who you are. You can do it anonymously. And if you need some help and you want to anonymously call us, please feel free to do so at 1-800-796-8226 at any time of the day, noon, and night. Thank you.
Sure. Hi, my name is Lon Myers, and I'm a therapist with Western Psychiatric Hospital. I work specifically in the STEP clinic, which is the services for the treatment of early psychosis. And I see clients anywhere from the ages of 14 to 40 on the outpatient level. So I do individual therapy, and our team at the STEP clinic comes with a whole lot of people, a psychiatrist, and they also see a supportive education and employment specialist, peer specialist, a whole variety of different services that we offer.
Okay, so how important is mental health?
It is one of the most important things I'm an advocate for. You can take care of your, like your heart, your diabetes, all those things. It is just as important to take care of your mental health as well.
Sometimes because we cannot see our mind and people cannot know what's happening in our minds, we feel like mental health is not that important. Thank you for coming to enlighten us about that, because this is one topic that we rarely talk about. So how do you know that this person needs that help?
Well, we do have a lot of referrals that come through from the inpatient level. They're already hospitalized. Sometimes it's from their primary care doctor. Resolve, who is one of our great partners. Well, sometimes Danielle and I were just chatting about a client that they had referred over to our clinic. So a whole bunch of different variety of ways that people come to us. Sometimes people are happy about it, and sometimes sometimes people are not happy about it. And I have my wonderful team members here too.
Okay.
We all work together.
Okay. Thank you so much for coming, and thank you for sharing.
Hi, my name is Coran. I am a nurse practitioner. I am dual certified in family medicine and in psychiatry. I see a lot of patients in an underserved clinic out in Fayette County, Pennsylvania, and it's very important that people seek out treatment for mental health concerns that they may have in order to feel better about themselves and just have a better life overall.
That's very interesting to know, because today, as we were sitting there listening to you, I realized that there's a lot of things that people do not know. So how would you describe mental health?
Mental health it's different for everybody. That's the first thing. Everybody's mental health journey is not the same. The first thing you need to understand is that it can be somebody from depression to anxiety to post-traumatic stress disorder to learning disabilities. There's a whole spectrum that is covered under mental health. So everybody's story is not the same, and that's the most important thing. And just because that somebody's story is not as severe as being hospitalized doesn't mean that it's not important or it shouldn't be taken seriously.
So at what point can someone say, now I need to go and see Korean?
So whenever you feel a little different, a little off, maybe feeling sad but you don't have a reason why, starting to get anxious but you don't know why, or maybe it's been happening your whole entire life and you have no explanation for it, that is the time that maybe you want to, first and foremost, you want to seek out a provider, whether it's a therapist or your primary care doctor or a mental health facility, whether that is at an inpatient unit or an outpatient unit, somewhere you can say, hey, there's something going on, I'm not really sure what it is, but I'm trying to figure out what it is.
So when do you know that now this is really an issue, I need to maybe help this person? I think that's about what we want to know, right?
Okay. So I always tell individuals that it's okay to not be okay. We are not robots. We are not meant to not have feelings. People need to have feelings. We're human. That's what connects us to other people. But the biggest aspect is whenever your emotions or your thoughts are taking over and you cannot do your daily activities. So you can't take care of your family, you're not getting up and going to work, you don't want to shower, you don't want to get out of bed. That's whenever you want to reach out and say, hey, I'm not okay, like I need to talk to somebody. And it's okay to say that you're not okay. The biggest thing is you being your own advocate is like the biggest thing that I can tell somebody to do. You are willing to advocate and take care of family members, to take care of your children, but what about you? You can't help anybody if you're not feeling well.
Right. I like that point very much, because sometimes when you have a headache, you quickly know that I need to take Tylenol. But when it comes to mental health, it's kind of like there's a stigma and people don't want to talk about it.
And it's because we can't see it that makes it difficult. So when you can't see it's easy to see that somebody breaks their leg and they need help. That is very simple to do. But whenever you're in your own mind and you're having a lot of thoughts that may be negative or causing anxiety, you can't see those. So that's what makes it more difficult to treat.
So apart from prayer, you can actually also see someone who can be able to help you with your mental state of affairs. I want to thank you so much for sharing this information. Is there a last word that you'd want to say to my viewers?
I think your viewers should maybe have the information for Resolve, because that is a great thing that you guys have out here in Allegheny County. And I'm not from Allegheny County, so I learned about that today. And I think that just to know to like reach out to somebody if you're not feeling okay, to talk about it is just so important. And we don't have to be ashamed of reaching out and saying, hey, I need to talk to somebody to kind of figure some things out. It's okay to talk to people. We are humans. That's what we like. We like being connected. So that's what we need to do.
Yes. Thank you so much for watching.